I'm going to show you the anterior thigh stretch. Going to come up to one knee, actually both knees, with the other foot planted in front of you so that you are on one knee. You may need a wall, a chair, table, something to help stabilize on. Doesn't really matter your lower foot, whether the toes are pointed or flat. Probably pointed on the back of your foot is easier than on the toes. Once you're in position like this, you want to get tall through your knee, your leg, your body. Start to notice your hips, your pelvis is probably kind of like this. You want to bring the pelvis and the hips further forward, bringing them underneath you. That's going to do a couple things. It's going to open through here. It's going to take your thigh bone, leg bone, back in the socket, bending it back. The other idea, place your hand, feel for the ridge, the bone of your hip bone right here. You'll feel a ridge, you'll feel a point. Just put your hand there somewhere. Glue your hands to that. Imagine that it's totally glued, cannot slide. And as you bring your pelvis forward, you also want to roll the hip back with the hand to help you find that. You don't need the hand there, but that can help you find it. So we are lifting forward and rolling so that we are opening through the hip socket, through the front of the thigh. You will likely feel a bit of a stretch of tissue that's tight through here. Once you start to feel that, breathe and starts to soften. You want to maintain this reaching and rolling back with the hip and the bending back with the thigh as your hips come forward. You want to stay with that, but breathe and soften any excess tension that you've got in there. Let your shoulders go, drop, let your jaw soften, let your neck soften. Make sure that you're breathing and not clenching. We're going to stay with this for a few minutes. You may find there's just a little bit more room to roll the hip back now that you've softened. Take out the slack if you feel any. We want to actively roll that hip back the entire time. Remember, it takes 5 minutes or so to get a good, thorough, effective fascial release. Stay with it for the entire time. Rolling back, lengthening the knee into the ground is another way to think about it. Lengthen your leg, knee going into the ground. And as you breathe, start to imagine that you can breathe in this space, in the hip, in the thigh. Imagine that it's breathing. With every inhale and exhale, there's a little bit of contraction and expansion happening in there. It tends to feel very, almost rippy, as those tissues are kind of literally pulling longer. Never force anything. We're not actually ripping anything, but it can kind of feel like that. It can start to get intense. If you need to, very, very slightly ease up a little bit without losing any of that reaching and lengthening. Now what I'm doing, see if you can find this yourself, I'm starting to rotate the thigh bone, leg bone, in the hip socket by twisting my pelvis my body, but in particular my pelvis, so that my leg bone is going this way relative. You can do it either way, doesn't matter. Pick a direction and try rotating just a little bit the thigh bone in the hip socket. Tiny bits of movement, very small, a millimeter or two. If you're like most, you'll start to notice that this area is very, very tight. Hasn't moved, hasn't been this joint hasn't worked this way in a long time. Breathe and open that space in that tight hip and thigh. Now what I'm doing, I'm starting to shift my weight away from this leg, which draws this side up a little bit and drops this side a little bit, opening my thigh in a leg coming out away from me to my side kind of direction. There's not much room there, but look for it and look to increase it. Breathe and allow that tissue to melt. Now that we've been with this for a little bit, start to look for little tiny movements. The thigh bone, hip bone in there moving just a little bit. A little bit of rotation, a little bit of bending, a little bit of opening. I was opening through the thigh in a way that my knee was coming out this way, or rather my body was going that way. Let's go the other direction. Bring your hips over and past the knee. Keep rolling the hip back. Keep opening through here as you sink your hips over and past the knee. And remember to breathe. If you catch yourself clenching or bracing anywhere, breathe in, breathe out and soften. Let go of any excess tension that's not needed here. And look for any areas where you can take out a little bit of extra slack, a little bit more of rolling the hip, a little bit more sinking with the hip to the side, a little bit more lean forward. And then slowly, slowly, slowly starts to ease off of that. your hip back underneath. Allow it to return to a more normal position. This can bring up a lot of tightness and stiffness in the low back, being in this position for that long. Gently move your pelvis back and forth, kind of a cat-cow type movement, but here in kneeling. You can piston your hips a little bit, one hip up, the other hip down, alternate. Bring your one leg down, back to your knees, and then to a cat-cow, and just help that area feel loose enough again after having gone through that release. That stiffness and soreness that you are possibly feeling will fade in just a moment or two.